Department of Child and Adolescent Psychiatry, Kohnodai Hospital, National Center for Global Health and Medicine. Around 20% of the world's children and adolescents have mental disorders or problems. Interventions aimed at promoting mental health and preventing mental disorders in children and adolescents have increased scientific evidence that they are effective and cost-effective. Children's mental health problems are likely to occur in any country, and a training system for child psychiatrists should be implemented in all countries. NCGM has 2 hospitals, a university, and an institute. NCGM has a hospital, a university, and an institute in Tokyo. Kohnodai Hospital is a general hospital located in Ichikawa, Chiba Prefecture. The history of child and adolescent psychiatry in Japan began from the time when the child psychiatric wards of Kohnodai Hospital were established. Japan is facing a problem of declining birth rate and aging population. While the number of children has decreased, societal interest in children's mental health has increased. There are many mental health problems in our country, including neurodevelopment disorders, ASD and ADHD, truancy, abuse, suicide, lack of CAP experts, and other serious issues. 1872, Kohnodai Hospital is established. 1936, Kohnodai Hospital becomes Kohnodai Army Hospital. 1945, National Kohnodai Hospital is established by Ministry of Health and Welfare. 1952, the National Institute of Mental Health is established beside the hospital. 1987, National Kohnodai Hospital is integrated with the National Center of Neurology and Psychiatry, NCNP. 2005, the National Institute of Mental Health is moved to Tokyo. 2008, NCNP Kohnodai Hospital is changed from NCNP to the International Medical Center of Japan, IMCJ. 2010, IMCJ is changed to the National Center for Global Health and Medicine, NCGM. Kohnodai Hospital is the oldest hospital to have a child and adolescent psychiatric ward in Japan. Kohnodai Hospital has been treating children with psychiatric problems since 1948. In 1965, Ichikawa City set up an in-hospital class for hospitalized children with CAPs for the first time in the country. The current CAP ward was established in 1972, and a CAP outpatient unit was established in 1975. In 2019, NCGM set up the Clinical Center for Children's Mental Health in Kohnodai Hospital. There are few hospitals and few child and adolescent psychiatrists. The large number of children on waiting lists to be examined is a major social issue in Japan. Neurodevelopmental disorders, for example, ASD or ADHD, truancy, and suicide are major child mental health issues. This graph shows the number of outpatients at the Department of Child and Adolescent Psychiatry since 1998. The number grew rapidly starting in 1998, and in 2001, the system was changed to require an initial appointment. Around 2005, there was a waiting list of about a year for the first examination. The rate of autism was considered to be 1 person in 5,000 in 1975, but 1 person in 110 is considered to have ASD in a recent survey, Weintraub, Nature, 2011. Neurodevelopmental disorders are a major issue in schools. Drugs for ADHD such as methylphenidate, atomoxetine, guanfacine, and lisdexamfetamine, and drugs for ASD such as pimozide, risperidone, aripiprazole have appeared in Japan. In Japan, the number of suicides among those under 18 are about 500, and the number of suicides among those under junior high school age in 2016 is 105. Even with the declining birth rate, the number of suicides of children has remained almost the same since after World War II. The number of suicides among those under 19 years old in 2016 is 493, 319 boys and 174 girls. In 2015, the number of children exhibiting truancy behavior was 27,581 in primary school, or 0.42%, and 98,428 in junior high school, or 2.83%. Child abuse is mainly handled by child counseling centers and is a problem in the area of child welfare in Japan. Child counseling centers cannot cope with the rapid increase in child abuse. The number of staff at child counseling centers has been increased, but increasing the number of child counseling centers is an urgent issue. There are few specialized hospitals that can treat children's mental health problems, such as PTSD, due to child abuse. Child abuse is a very serious issue in Japan. Child abuse is mainly handled by child counseling centers and is a problem in the area of child welfare in the country. While that number is growing, the number of cases responded to with child abuse counseling by the 212 child guidance centers nationwide during fiscal year 2018 was 159,850. In Japan, the most common types of abuse are psychological abuse, followed by physical abuse, neglect, and sexual abuse. Child abuse is mainly handled by child counseling centers and is a problem in the area of child welfare in Japan. There are few specialized hospitals that can treat children's mental health problems, such as PTSD, due to child abuse. In Kohnodai Hospital, NCGM, the number of neurodevelopmental disorders, F7, F8, F9, is 62%. Unlike adult psychiatry, schizophrenia and mood disorders are rare in child and adolescent psychiatry. In Kohnodai Hospital, there are various treatments for children and adolescents. For example, psychodynamic individual therapy, guidance for parents, group therapy, play therapy, daycare, pharmacotherapy, parent training for ADHD, cognitive behavior therapy, or UPC, and inpatient treatment. Kohnodai Hospital was the first hospital in Japan to offer daycare and has the oldest child psychiatric ward in the country. Our hospital has a special ward for child and adolescent psychiatry. Its treatment structure is as follows: a 45-bed open psychiatry ward, 13 private rooms and 32 for-patient rooms, 5 full-time physicians and 8 residents, 3 psychologists, 2 social workers, and 27 nurses. A mixed-gender ward. An in-hospital school. Ward meetings by inpatients and staff, weekly. Group therapy for middle school boys and girls, every other week. Various recreational plans, e.g. camping, climbing, walking near parks. A hall and video games. The study room. There are many Japanese manga. This is the children's room. This ward is less than 50 years old and built to an old standard, and is very small compared to recently built wards. The picture on the right is a bed for a child with ADHD. I don't know where the bed is. 1. Individual psychotherapy, including play therapy, cognitive behavioral therapy, or CBT, etc. 2. Group therapy, group activity therapy, camp. Group psychotherapy, for example, community meetings. 3. Physical treatment, such as medication. 3. Physical treatment, such as medication. 4. Family interventions, parent guidance, ward family meetings. Parent training, family therapy. 5. Various occupational therapies. 6. Family psychoeducation, eating disorders, OCD. 7. Hospital classrooms, learning support, camps, events, etc. 8. Cooperation with other institutions, stakeholders meetings. Child guidance centers, educational counseling agencies, etc. There are various treatments by other professionals such as support for children and parents. In Kohnodai Hospital, NCGM, there are many inpatients with neurodevelopmental disorders, F8, F9. Anorexia nervosa is a serious condition that requires hospitalization. There are also many children with F4 with truancy as the main problem. Kohnodai Hospital has an elementary and a junior high school in the hospital for inpatients. There are 2 teachers and 4 students in elementary school, and 5 teachers and 40 students in junior high school. This school has an air-conditioned gymnasium. The purpose is to keep a continual support system in place in the community over the period until when the child with a mental disorder becomes an adult. It is necessary for there to be cooperation between the various specialist organizations such as hospitals, welfare centers, educational centers, the police, and child consultation centers. We have established and are continuing to manage a case management system. This system is in place in Ichikawa City and links specialized organizations in the community which deal with troubled children.